Hello and welcome back to my YouTube channel. Today's video will be on Leiomyomas. Now onwards, I will be including more of the topics related to your exams in my videos. So do subscribe to my channel and keep watching my videos. Let's get started with Leiomyomas.
Leiomyomas, also known as fibroids, are commonly seen in uterus of female aged 35 to 65. These are benign mesenchymal neoplasms of smooth muscle cells. The common locations are uterus, cervix, fallopian tubes, broad ligament, ovary, stomach, small intestine, etc. There are three types of uterine leiomyomas depending on their location: subserosal, submucosal, and intramural of the leiomyoma, and is depicted in the picture by an arrow. The submucosal leiomyomas are the leiomyomas which are within the uterine cavity as it is depicted in the image shown. Intramural leiomyomas are the leiomyomas which are within the myometrium. Again, in this image, I have shown the subserosal, submucosal, and intramural leiomyomas, as you can appreciate in this. Coming to the signs and symptoms of leiomyomas, the patients are females who present with following symptoms and signs: abdominal discomfort or abdominal pain or pelvic pain, bleeding per vaginum or menorrhagia, sometimes with amenorrhea, dyspareunia, and infertility. In cases of larger leiomyomas which are obstructing the birth canal, the woman will also face infertility. So these are some common signs and symptoms of leiomyomas. I'll repeat it again: abdominal or pelvic pain, bleeding per vaginum, amenorrhea or menorrhagia, dyspareunia, and infertility. Coming to the diagnosis of leiomyomas, the leiomyomas are generally diagnosed by ultrasound. Transabdominal ultrasound and transpelvic ultrasound are usually done, and this is effective to diagnose a leiomyoma. Coming to the gross features of a leiomyoma. When the biopsy is received, can be received as a myomectomy specimen, or it can be received as a total abdominal hysterectomy specimen. So, whenever we cut the leiomyoma, we always see that leiomyomas are circumscribed neoplasm and the cut surface is generally gray white and whorled. Coming to the histopathology of leiomyoma. When in the H&E section of a leiomyoma is observed under the microscope, it shows interlacing fascicles of smooth muscle cells. These smooth muscle cells are spindle shaped with minimal nuclear pleomorphism. No increased mitotic figures, necrosis, hemorrhage, and atypia usually are seen in the sections. Coming to some changes which can be noted in the leiomyomas: red degeneration or areas of hemorrhage and hydropic changes or area of edema can be sometimes seen in a leiomyoma. Few leiomyomas may show atypical features in form of nuclear hyperchromasia, and some may have increased mitotic figures, but generally in a leiomyoma the number of mitotic figures are less than 5 per 10 high power field. Coming to the variants of leiomyoma, the leiomyoma are of several types like cellular leiomyoma, atypical leiomyoma, mitotically active leiomyoma, hydropic leiomyoma, diffuse leiomyoma, dissecting leiomyoma, myxoid leiomyoma, apoplectic leiomyoma, lipoleiomyoma, and leiomyoma with bizarre nuclear features. In cases of cellular leiomyoma, the cellularity of the leiomyoma is more than than in usual leiomyomas, and it can be diagnosed by seeing the adjacent myometrium, which shows normal cellularity. However, if the leiomyoma is cellular, it will show hypercellularity in the area of leiomyoma. Coming to atypical leiomyoma, the atypical leiomyoma have atypical features, and in this we can see moderate to high degree of atypia, but the mitotic figures here are almost normal, and less than 5, and there is no areas of necrosis. Mitotically active leiomyoma is when the leiomyoma is having mitotic figures more than 5 but less than 14, or according to some authors less than 15. Hydropic leiomyoma is when the leiomyoma is having hydropic changes or edema like changes which gives eosinophilic appearance to the cells and its surroundings. Diffuse leiomyoma, when the leiomyoma is not circumscribed but is in a diffuse fashion, then it is known as a diffuse leiomyoma. Dissecting leiomyoma. Dissecting leiomyomas are those leiomyomas which have nodules of smooth muscle cells dissecting in the myometrium, and occasionally hydropic changes and intravenous extension can be seen. This is also known as cotyloid leiomyoma if it extends outside the uterus. Myxoid leiomyomas are hypocellular tumor, and in this the cells are separated by myxoid matrix composed of glycosaminoglycans which are allicin blue positive and occupy more than or equal to 50% of the overall tumor volume. Coming to apoplectic leiomyoma. The apoplectic leiomyomas have central zone of hemorrhage and necrosis with increased mitotic activity in its periphery or myxoid changes, also known as zonation phenomenon. Lipoleiomyomas are leiomyomas in which there is adipose tissue or adipose cells in between the smooth muscle cell bundles. Leiomyoma with bizarre nuclear features have leiomyomas in which certain cells have bizarre nuclear features in form of nuclear pleomorphism and multinucleation. Coming to the IHC profile of leiomyomas, the positive markers for leiomyomas are smooth muscle actin, desmin, H-keldesmon, transgelin, ER, PR, and WT1. Coming to the differential diagnosis of leiomyomas, well, it is important to differentiate leiomyomas from smooth muscle tumor of uncertain malignant potential, from leiomyosarcoma sometimes, and sometimes from endometrial stromal nodule. Also, PCOMA and inflammatory myofibroblastic tumor are also some of the common DDs, and we have to differentiate a leiomyoma from all these entities to clinch the diagnosis of leiomyoma and the variant of leiomyoma. Coming to the treatment part of leiomyoma. Generally, myomectomy or surgical excision of the leiomyoma is appropriate for small to medium sized accessible leiomyomas. Hysterectomy, preferably laparoscopic, is done in females who have completed their family. Laser ablation is another option in those centers where it is practiced. Also, some forms of medical treatments are given to reduce the size of leiomyoma, which are progesterone, levonorgestrel, gonadotropin releasing hormone analogs, or aromatase inhibitors. In some places, interventional treatments like uterine artery embolization or radiofrequency myolysis or laser ablation is used.
So this was all about leiomyomas. I hope this lecture was useful for you all. See you in the next video, and once more a reminder to subscribe to the channel. Thank you and bye for now.